Many people experience waking up to urinate after falling asleep. This is referred to as nocturia, or nocturnal urination. Nocturia means waking up from sleep to urinate. If you have to get out of bed to urinate more than once at night, you can be diagnosed with nocturia. If we follow this criterion, it seems that we all might be nocturia patients. Because nocturia is so common, many people do not take waking up at night to urinate seriously. However, if you wake up more than twice a night due to nocturnal urination and find it difficult to fall back asleep, it can be perceived as a serious problem. Approximately 69% of men and 76% of women over the age of 40 experience waking up at least once at night to go to the bathroom. It is said that 50% of men over the age of 70 wake up at least twice at night to urinate. Nocturia occurs in approximately 80% to 100% of elderly individuals. When nocturia occurs, frequent waking up to urinate during sleep reduces sleep time, fragments sleep, and makes it difficult to fall back asleep, thereby lowering the quality of sleep. About 20 to 30% of people wake up once during sleep due to nocturia, 40 to 50% wake up more than twice, and those who experience nocturia 3 or more times can be as high as 60 to 70%. This leads to a decrease in sleep quality and a reduction in overall sleep time. It is said that only about 20% of the daily urine production is made during the 7 to 8 hours of sleep. Because it is produced in such small amounts, we should not wake up due to urination while sleeping. However, if more urine is produced at night, the bladder capacity is reduced, or various sleep disorders such as sleep apnea occur. Nocturia is likely to happen. Let's look into cases where excessive urine is produced at night. This often happens when a person consumes a lot of fluids, has diabetes, or has impaired kidney function that affects urine regulation. Additionally, taking medications such as diuretics can also lead to increased urine production. It is possible to consider cases where a lot of urine is produced only at night. This applies to people with severe leg edema. When a person with severe leg edema lies down to sleep, the edema that was concentrated in the legs gets redistributed to other parts of the body, resulting in increased urine production. Therefore, conditions that cause leg edema, such as heart disease or kidney problems, can lead to nocturia. It would be best to quickly address the underlying leg edema. As people age, their circadian rhythm fluctuates and weakens. Even if they go to bed at the desired time, the biological clock may cause increased nocturnal urination. For the elderly, it seems important to maintain a consistent sleep rhythm. Secondly, a decrease in bladder capacity can be considered. Even if nocturnal urination does not increase, a reduced bladder capacity can lead to an increased urge to urinate, causing nocturia. What are some cases where this might occur? In cases of urinary tract infection, benign prostatic hyperplasia, overactive bladder symptoms, and people who develop stones in the bladder capacity is reduced, which can lead to nocturia. Thirdly, if there are sleep disorders such as sleep apnea, nocturia is likely to occur. Sleep apnea patients experience a sleep disorder where the muscles of the upper airway, specifically the base of the tongue, lose tension during sleep, causing the airway to become blocked and the brain to wake up repeatedly. About 50% of patients with sleep apnea develop nocturia. It is said that 80% of patients with severe sleep apnea experience nocturnal urination. The reason is that when the airway is blocked, oxygen levels decrease and carbon dioxide levels increase, causing the vagus nerve to become overactive. This suppresses the secretion of vasopressin from the pituitary gland, leading to increased urine production. Additionally, when the upper airway is obstructed due to sleep apnea, negative pressure is created within the thoracic cavity in our chest. When negative pressure is created, the amount of blood leaving the heart decreases, and the amount of blood entering the heart increases. As a result, the blood flow to the heart increases, leading to higher blood pressure, which in turn stimulates the atrial natriuretic peptide, causing more urine production. To eliminate or reduce nocturia, it is necessary to treat the underlying factors or diseases. By changing several lifestyle habits, you can reduce the occurrence of nocturia. The first step is to reduce fluid intake in the evening before going to bed. The second is to reduce the intake of alcohol or caffeine, which produce a lot of urine in the evening. Third, to reduce the reabsorption of leg edema and its conversion to urine. During sleep, it can be helpful to elevate your legs above heart level for 1 to 2 hours before going to bed. Fourth, maintaining good sleep habits can help reduce nocturia by preventing waking up in the middle of the night. To achieve this, it is recommended to maintain a consistent sleep schedule by going to bed and waking up at the same time on both weekdays and weekends. Please consistently maintain a bedtime routine for 1 hour every night before going to sleep. If you find it difficult to fall back asleep after going to the bathroom, try learning and practicing relaxation techniques to calm your mind. Lastly, it is important to block blue light, which can suppress the production of melatonin, a hormone that promotes sleep. Try to avoid using smartphones or electronic devices 1 to 2 hours before bedtime to help you fall asleep more easily. Nocturia can increase the risk of falls in the elderly. It might be helpful to keep a nightlight on along the path from the bedroom to the bathroom to prevent falls. Secondly, making the pathway safe by removing objects that could be tripped over or placing mats can also be helpful. If there are mobility issues, it can be a good idea to place a urinal or a commode next to the bed to avoid having to rush to the bathroom upon waking. The best way to reduce nocturia is to maintain healthy sleep and good sleep habits. It would be beneficial to watch various videos on Honey Sleep Tube to help you establish and maintain your healthy sleep habits. Wishing you all healthy sleep, we will conclude today's broadcast.